is a pleasure to be here in this webinar. I am the head of infectious disease at the Hospital Sant Trias, which is a hospital north of Barcelona. And together with Lourdes Mateu, Lourdes Mateu coordinates in my team. She coordinates the largest long COVID unit in Spain. The first question where I want to start is by saying in this review, this viewpoint from Lisa McCorkle and Michael Peluso. So the first point is that was published in Nature is that a lot of people has long COVID. You can see here the size of the different bubbles, circumferences are representative of the number of people who are affected. On the left-hand side, the darker green bubble represents the latest estimates from late last year, which is when we stopped counting actually acute COVID-19 cases around the world. And there were estimations that there would be at least 65 million people at that time having long COVID globally. But what is long COVID? Long COVID is increasingly recognized true disease or true syndrome that has been defined, that was unknown when several, like 3 years ago, and started being defined about three and a half years ago by different groups. And one of the issues here is that there are slightly different definitions of long COVID. So the WHO definition differs slightly from the NICE definition, from CDC, from NIH. But long COVID was actually defined by patients themselves, actually in Twitter, our current X, but we are increasingly converging towards a definition where the long COVID is a syndrome characterized by persistent presence and persistence of number of different symptoms and problems that occur following acute SARS-CoV-2 infection, and they persist for at least 3 months. This seems to be the more specific, definition. Long COVID is a systemic disease that affects multiple organ systems that are summarized here. So it can affect the heart, it can lead also to chest pain, heart palpitations, myocarditis, myocardial inflammation, etc., but also affects the lungs in the presence of dyspnea, fatigue. Also creates a number of very important and disabling symptoms and problems in the neurological sphere, like anxiety, depression, but also headaches, anosmia, nausea, fatigue, malaise, POTS, but it also has, alterations in the kidney, the endocrine system. The post-acute COVID syndrome, which includes at least 3 different. This is a slide that we prepared. This is our opinion. This is based on our clinical experience, but it's consistent with what others think. So there's a mixture of different entities, and it's important to define those different entities because the pathogenesis might be slightly different. For example, a number of subjects with post-COVID syndrome might have post-intensive care syndrome, which is actually it's not new. It was well known. This occurs always after ICU. And it's also a direct result of mechanical ventilation, ECMO, immobilization, shock. And it is highly disabling, but slowly recovers with possible long-term sequelae, but tends to recover. Then we have a number of what we call the midterm sequelae, like smell and taste, thirst, anxiety, which have a clear pathogenesis or maybe are highly unspecific, but eventually tend to resolve. So smell and taste problems continue for many months, but they show a trend towards getting better over time, over many months. I'm not saying by that they are not important, but they tend to resolve. However, long COVID is a completely new syndrome which has a post-viral origin. It can even occur following mild COVID-19 disease. It has a super complex immunopathogenesis. It can last for years. And so far, there is no pharmacological treatment. There are treatments, and this is important. It can be treated. That's why it has to be diagnosed. But current treatments are essentially based in rehabilitation and muscular rehabilitation, and there are no pharmacological treatments so far. And unfortunately, there are still no biomarkers risks and 12-month burdens in survivors of COVID-19 are very high, either in cardiovascular outcomes, including inflammatory heart disease, arrhythmia, but also neurological outcomes such as stroke, sensory disorders, and also gastrointestinal outcomes. And what is important is that, yes, people with more severe disease are more affected, but also the burden is very high, even for people with acute mild COVID-19. Thank you for listening.